Oh, okay. We will call the Tuesday, May 7th City Council meeting to order. Use my little gavel here. Would the clerk please call the roll?
Counselor Eber?
Here.
Counselor Holen?
Here.
Counselor Wheel?
Happy to be here.
Counselor Sheldon?
Here.
Counselor Blum is absent. Counselor McGuire is absent.
Please stand for the Pledge of Allegiance. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And now we have a presentation from our new Arapahoe County Public Health Department. Please welcome Leslie. Do you pronounce it Levine or Levine? Levine. Thank you for being here.
Yeah.
All right, there we go. Thank you so much. Good evening. Really appreciate having some time on your agenda to provide some updates about Arapahoe County Public Health. Next slide, please. And again, I'm Leslie Levine. I'm a Senior Community Health Promotion Specialist with Arapahoe County Public Health. So I have just a few minutes with you tonight. We'll briefly be talking about some updates from the health department with our first year in 2023. We'll do a brief overview about the community health assessment process, and then we'll talk about tobacco and vaping prevention policies. Next slide, please. So as you may recall, Tri-County Health Department shut down at the end of 2022, and Arapahoe County Public Health opened our doors January 1, 2023, and it was the proverbial build the airplane while we are flying it. So we were putting the health department together while getting services out into the community. So what you see is just a brief snapshot of some of the work that we accomplished in 2023. And those numbers are increasing in 2024. So we continue to address outbreaks in the community, issue birth and death certificates, provide environmental health inspections such as restaurant inspections, and work with our women, infant, and children clients. Next slide, please. So as a health department, every 5 years, we are required to conduct a community health assessment and then create a community health improvement plan. So the second half of 2023, we released a survey to the community, and really happy that we received over 1,000 responses from community members and partner organizations. And we take that information and put it towards the creation of our community health improvement plan. So it helps us track the public health issues, what are the top concerns, we identify our priorities, and then we move into the strategic planning process. And next slide, please. So this is a really quick overview. These are the top issues that were identified through the community health assessment. The next phase will be creating the community health improvement plan. We will be having a meeting on June 25th from 2 to 5 p.m. via Zoom. We'll share information with Jim, who can pass it along to you all. We would really love to have input from City Council, from city staff, to help inform this county-wide community health improvement plan. I do want to put a quick plug in under the topic of food. Arapahoe County has just launched a food security collaboration. We're partnering with the Graceful Foundation based out of Littleton so that we can identify what are our assets, what are our deficits, and how do we better get food to the people who are needing it. So very excited about that. All right, next slide, please. All right, so I'm going to quickly shift over to vaping and tobacco prevention. This is one of the areas that I cover. What we see with the tobacco and nicotine industries is they are constantly releasing new products to get our youth attached and addicted to these products. So we have to be really deliberate about taking steps to prevent them from uptake of this behavior in the first place. And also for those who are currently addicted, how can we get them to decrease their behaviors or stop altogether? So what you see on the screen, these are a couple of the products that are most popular among our youth. Puff Bar, the Elf Bar, and then Zyn is actually a nicotine pouch. The kids just don't understand. They are very high in nicotine. They have harmful chemicals, and they're just not good for their health. Next slide, please. So as part of our grant from the Colorado Department of Public Health and Environment, we're required to conduct a tobacco-focused community assessment. We did that last summer. And here is a snapshot of some of the data. So what you're basically seeing is, thank goodness, the rates of tobacco and nicotine use among our high school students is decreasing. What is increasing is use among our middle school students, and in Colorado, as well as around the country, we're even starting to see it among our elementary school students. So they are starting to vape and trying vaping at younger ages. Vaping continues to be the second most commonly used substance behind alcohol use, and thankfully we're seeing our high schoolers at high rates trying to quit. And I put the emphasis on trying because it is a highly addictive substance. Next slide, please. So I'm here before you tonight because there are 3 buckets of policies that are evidence-based that can contribute to preventing youth from starting in the first place and stopping once they have started the habit. The first being cost. Youth are very price sensitive with any kind of product, so increasing the cost of tobacco and nicotine products. The second is tobacco retail licensing. The state has a program run out of the Department of Revenue. Cherry Hills Village has one tobacco retailer, so probably not the best bang for your buck. And so that leaves the third category of smoke and vapor-free public places. This is really important because youth have this perception that everyone is doing it. Everyone is smoking and everyone is vaping. So if we can decrease the modeling that they see, the less people who they see doing smoking and vaping, it denormalizes that behavior for them. Next slide, please. So where you have an opportunity to make a difference is with your parks. So the municipality oversees 2 parks, and in my research, I didn't see that there was a smoking and vape-free policy in place. And so why is this important for your youth? So think about it. When you go to one of your parks or a park in the area, you want to have a healthy smoke and vape-free experience at a park. So putting that ban in place helps that. Obviously, we want to keep our parks free from pollution, and we obviously want to prevent fires. Something that I learned as I got more involved in tobacco prevention is not only are cigarette butts a toxic substance, they are the most frequent piece of litter in the world. So we want to keep cigarette butts out of our parks. And what people don't also realize is that vapes are a hazardous substance as well. Think about the lithium batteries and think about that nicotine juice. So we want to keep people from throwing these products in our parks. And then lastly, so those vapes, again, are hazardous waste, and we want to keep those away from our parks and away from our kids. So by putting a policy like this into place, what do we hope to accomplish? Obviously, let's decrease waste and litter. Secondhand smoke. People might think that it is only harmful in indoor settings. It's harmful in outdoor settings as well. There is no safe level of exposure of secondhand smoke or secondhand vape. So keeping it out of our parks obviously decreases that exposure. As I said, let's look at those social norms, let our kids see this behavior less frequently, decrease the uptake of the behavior, help our kids stop the behavior once they have started. And ultimately, what we're doing is helping to reduce chronic disease among our youth and among our adults. Next slide, please. So here's my contact information. Please feel free to use me as a contact for the health department, whether you have an interest in talking about food insecurity, nutrition and vaping, or other services that the health department provides. We would love to engage with you. Have conversation with you and understand what are your concerns that you have in the community and that you have among the health with your children. So that is all that I have, and I think we have a minute or two for questions.
Does anyone, yep, Councilor Holland.
I got a couple questions. One is just in general, so how has it been, the county health department standing up from beginning of 2023 through now? Has it been easier, harder, surprises, no surprises? How would you?
So speaking on behalf of the director, Jennifer Ludwig, it's been a little bit of everything. What I can say is that people have really enjoyed, I didn't transition over from Tri-County Health Department, but what I can say for my colleagues is that they have really enjoyed being able to dig in at the county level. As you can imagine, overseeing 3 counties and as large as Adams, Arapahoe, and Douglas counties are, you can't really be that hands-on with any one county or municipality. And so this is really giving us that opportunity to build those relationships and really support the communities in a much deeper way. So I think Jennifer would say it's been a roller coaster with ups and downs and continuing to build out and build our capacity.
Terrific. Well, that's great. The other question I have is where did you get those statistics? I mean, how did you determine those statistics on teen vaping?
So there are a number of different resources. So one of the biggest ones is the Healthy Kids Colorado survey. That is conducted in middle and high schools every other year. That data came from the 2021 survey. 2023 data should be available in July, so we're really looking forward to that. The caveat that I will give you is that Cherry Creek Schools does not participate in that survey. They have their own, I think they call it a culture and wellness survey. So have a meeting set up next month so I can start to understand some of that data. So we do generalize across the county. I believe Sheridan participates in that survey, maybe Inglewood as well. So.
Well, not that my opinion means anything, but I can tell you, I don't know, but I know that it's way higher than 3 in 10 in the Cherry Creek school system. It is a much bigger problem than that, much bigger, and it needs to be dealt with. And I know you guys are dealing with it, but I mean, to anybody listening, this is an issue that needs to be dealt with.
Yes, thank
It's
you.
much bigger than that.
It's, as we start to have conversations with administrators and individual schools, we are hearing more and more that it is an issue that the students are highly addicted, and we can't, I feel very strongly, we can't punish them into good behavior. And what are the ways that we can integrate some positive youth supports? How can we address them, understanding that they have an addiction, get them into supportive services, while we also provide a lot of education and look at that policy landscape to see how we can denormalize that behavior.
Any other, yep, Counselor Sheldon?
Yeah. I do have a question for you. Thanks for the great presentation, Leslie. I appreciate it. Do you have examples of other parks in the county that are implementing a smoke-free environment?
So Littleton does have a ban on smoking and vaping with their parks and trails, and I want to say there was something else in that category, but they do currently ban it with their Main Street, which I know is not applicable for you all. Their entire downtown area is smoke and vape free, except on rooftops and patios that would be behind the building. So they have taken some extra steps to do that. I'm hoping to have some conversations with South Suburban to look at their policy. They've got certain instances where it's pickleball and tennis courts, but not comprehensively. So there's
Okay.
definitely an opportunity to address that.
Thank you.
Yeah, Counselor Wheel?
Thank you. I'm curious, I really don't know much about vaping and costs, but, you know, I've watched cigarettes from when I was a kid at, 25 cents a pack, which dates me to some degree, but I look at the prices in the grocery stores, it's like almost $10 a pack, and most of that's taxes. I'm saying to myself, wow, I wonder how people afford this, or why they afford it. But the, I don't know if they've approached the vaping issue through the taxation. And the justification was you're causing a lot of downstream costs that need to be covered. It seems to me, like you mentioned price sensitivity, and it seems to me like that might be an avenue, yourselves, colleagues in other counties banding together and getting some state movement if there's room to do that.
So let's see. So taxes is an area at the state level and actually at the local level either that I'm able to be hands-on with. There will always be folks who are interested in increasing the rates. I think it was in 2020 that Prop EE passed when we most recently raised the tax. So I will assume that there are folks who are continuing to strategize of how do we keep raising the cost where a lot of that money is allocated towards education and cessation. But I don't know that I can speak more specifically than that. I'm happy to follow up with you, though.
I'm cheering you on.
Yeah, Counselor Eber?
Thanks again, Leslie, for the presentation. I greatly appreciate it. Wanted to just check in on when you mentioned the ability to be a little bit more focused because we have only Arapahoe County now. I'm wondering whether or not we have information that kind of breaks us down across our diversity of types of people that are now in the county in terms of overall health, overall kind of pockets of, like you said, food insecurity, but it's more than that. It's just areas that we can find that have differences that need upgrading, I guess I would say, in terms of all different kinds of public health, whether it's vaccination, whether it's smoking, vaping, food, just general health choices. I mean, we hear a lot about in Denver that there are certain areas that just don't have good grocery stores in certain areas. I'd love to be able to figure out how we can make Arapahoe County as a whole, and therefore your job a little bit easier across that. As you know, we don't have any retail stores here, but
Great.
nonetheless, or at least grocery stores.
Yes.
So
So our data team would be happy to come back to council and provide more data than you could possibly imagine on those top 6 priority areas or data areas that you have an interest in. It's a little bit hard to break it out per municipality based on the amount of data that's available. When you're looking at a survey where you've got 1,000 responses, it's a little bit hard to parse that out. As I mentioned with Healthy Kids Colorado, not all of the school districts in the county are participating. So as they are able to, with the data sets that we have access to, they can do their best to provide information at that localized level, but absolutely at the Arapahoe County level. I can follow up with Jim and Laura and see if there's an opportunity for them to come and provide much more information for you about what a snapshot of the health of the county.
Well, thank you so much for being here. On that kind of closing note, I would just add that in other conversations with the county around their budget issues, and I think it would be interesting to know which services that the health department provides that Cherry Hills Village might actually make use of. I know different services are probably used in varying degrees throughout, various communities. I'm not sure that people in our community understand. I don't know that we have many people here with food insecurity. We might, I don't know that. But so that might, it would be interesting to know what the services you provide that residents do use frequently to help them understand the value and the benefit of their tax dollars.
I mean, I think in general, when you're looking at restaurant inspections, whether it is a restaurant that is in the city or ones that are nearby that they're going to, inspecting tattoo parlors and things of that nature, there are those services that people don't necessarily remember that the public health department oversees and ensures the health of our community. So I will pass along feedback to my colleagues and look forward to an email from me or from Jennifer Ludwig, and we'd love to continue engaging with you all.
Thank you so much.
Thanks for your time tonight. Okay.
Moving on to audience participation, seeing none, and also seeing no members of city boards or commissions, we will move to the consent agenda.
Okay. Move to approve the consent agenda.
Second.
All in favor?
Aye.
Any opposed? The consent agenda passes. There are no items removed. Unfinished business. Council Bill 2, Series 2024, amending Section 16.3.120 of the Municipal Code to amend certain fencing requirements on second and final reading. Director Workman.
Good evening, Madam Mayor and members of City Council. The intent is to get through this fairly rapidly this evening. I feel like we've talked quite a bit about fences here in the last year, 18 months. So I will really just kind of run through a couple of minor tweaks we made between first reading and second reading. And they were highlighted in your packet. They're on the screen before you. In Area 6, the City Attorney's Office and I coordinated to try and create some additional clarifying language related to where Area 6 would be located, specifically trying to create some additional clarity for those lots that are bound by both Albion and Colorado, and allowing those fences to be 6 foot tall and screen style on the east side of Colorado Boulevard. I do have the images if there's any questions related to those. And then again, there are some minor text changes just for clarity or for consistency with other portions of the code. Things like adding an S that was probably inadvertently left off, clarifying the gate opacity language, and then creating some text amendments to include both language and numbers to be consistent with other sections of the code. So with that, staff would recommend that council approve Council Bill 2, Series 2024 on second and final reading. That concludes my presentation, but I'm certainly available for any questions you all may have.
And I would just like to reiterate that we are at a later date going to revisit our discussion about state highways, so that's not reflected here, but we'll do that at another time. Are there any questions or any further conversation about the proposed changes?
I don't have any questions, but I would like to commend Paul and staff working on this. It's a big effort that you've undertaken here for a long time to get to a final document that hopefully gets approved tonight. So thank you for your effort.
All right.
Okay. Move to approve Council Bill 2, Series 2024, amending Section 16-3-120, fences, garden walls / perimeter walls, and enclosures of the municipal code on second and final reading.
Second.
It's been moved and seconded. Will the clerk please call the roll?
Counselor Eber?
Aye.
Counselor Holen?
Aye.
Counselor Wheel?
Aye.
Counselor Sheldon?
Aye.
That passes unanimously. There is no new business, and we'll move on to reports. I will be brief. The legislature is concluding tomorrow, and the bad news is that pretty much, not all, but the vast majority of the bills that we were concerned about and opposed to will pass if they have not already. The bill, House Bill 241313, which was the transit-oriented communities bill, passed today. 1152, the ADU bill, either passed today or probably will pass tomorrow. The parking requirements, prohibiting parking requirements bill also passed. Occupancy limits passed and has already been signed by the governor. The one that was concerning that did die was the bill around public access, providing online access and online testimony to all public meetings, not just council, but all commission meetings. That bill did not, it died in committee. So there have been an extraordinary number of amendments. So the bad news is these bills have all passed. The good news is that at least for the time being, while they are still all gross intrusions into home rule authority, they probably will not have a large impact on Cherry Hills Village. The transit-oriented communities bill was amended such that we are pretty clearly not included in a transit-oriented community and will therefore not be required to upzone any of our property. There was a very touch-and-go moment there where it looked like we might have to upzone about 120 acres to 40 units per acre. That was alarming, to say the least. But in the form that has passed, it seems like that will not be the case. The ADU bill was amended, but still maintains the provision that they have to be allowed as a use by right on any single-family zone lot.
But on that, though, I read something that they grandfathered in or they allowed.
That was a mistake.
So it was made a mistake several times, because I read it several times.
Yeah, it was, CML sent out an update, and I immediately contacted the CML lobbyist and said, I'm pretty sure that amendment passed because I've been listening to the various hearings. And she responded and said, oh, yeah, sorry, you're right. That amendment failed. So, yeah, so there is no grandfathering in on that one. The parking requirements bill was amended so heavily that it almost doesn't even, it's unrecognizable at this point. It really only applies to, municipalities can't impose parking restrictions on multifamily residential developments within transit-oriented areas, and possibly even if certain percentages of them are affordable, or, I mean, it's very specific at this point. And given that, at a minimum, we don't have any transit-oriented areas anymore, and second of all, we don't have any multifamily residential developments, that will not apply to us. But it is still of concern. So I'm not sure what the next steps will be. I'll be interested to have our next Metro Mayor's Caucus meeting and see where the other municipalities are in relation to home rule authority in general. And so I will keep you all apprised as that moves forward. Other reports? Councilor Eber.
Just real quick, attended another one of the noise roundtable meetings. Continued discussion on mostly about the lead issue. Areas south and east of the airport seem to be more heavily affected, although immediately to the west in the Greenwood / unincorporated Arapahoe County area around Cottonwood Elementary seem to be heavily impacted. They do offer a portable noise monitoring unit that if we want to have various locations in Cherry Hills, they'll come and set it up for us. It usually stays somewhere for a couple weeks, and then at least we can get a handle on what, if any, noise issues we have. And I was thinking that if we did do this, we could pick 2 or 3 different places around the village just to get kind of a handle. They do require it to be in a secure backyard versus just somebody who doesn't have a fence. But other than that, it's available. And I thought, frankly, that I would probably follow up a little bit on that just to get a handle so that people know. The other piece that I would quickly comment on is that while we're not being charged right now, that in 2025, they anticipate that they will again charge people. And I know we don't really, at least at this point, seem to have many issues about noise, but the master plan for the airport calls for a new control tower, bigger planes, and more planes. So I don't know necessarily, even if our ox isn't getting gored right now, it won't get gored in the future. So I continue to go to the meetings and I'll continue to report back. The other thing is I received something today from one of the constituents, actually in Earl's district, and I don't know why he chose to write to me, but he did want to see if we could pass a proclamation, and it just came to me literally at 3:23 this afternoon, so we couldn't do something like that.
I think
don't know
we
if
all
everybody
received,
else
yes,
got it.
we all received
Okay.
it. And I think we have talked with staff about trying to prepare something for the next
So I
meeting.
just wanted to mention that May is ALS month, and he would like it to be recognized and followed up upon. So thank you.
Councilor Hulin.
No report, but I would just like to commend Director Farman. You all saw the audit thing in the package. He did a great job in terms of pulling that together and created a really, really very good rubric that we utilize in the evaluation of the candidates. And anyway, I just wanted to say thanks a lot for that. It worked out, I think, really, really well. Thanks.
2 quick items. Rob Eber and I had interviewed candidates for both PTRC, 2 slots, and the Art Commission, 2 slots. Strong candidates, tough choices, but we've got some really good candidates. I believe they've all been notified. Have we heard back from, well, you can do that in your report, Laura. Okay. Anyway, so that's behind us. And Dr. Cog, they're working hard with an outside consultant to do some work on housing needs and, a broader, more holistic view of things. That should be available in early summer, and I'd like to see if I can arrange, if there's interest, for somebody from Dr. Cog to come on down and present it to us. I think it'll be worth our time, at least from what I've seen now, and I think it'll continue. That's all I have.
Thank you very much, Councilor Sheldon.
Thank you, Mayor. My only update is a reminder to the rest of council and the mayor, if you haven't already provided some names to Clerk Gillespie for our Citizens Committee or whatever we're calling it for cell phone coverage, please do that. We're trying to keep that ball rolling, so that's it. Thank you.
Thank you. City manager and staff.
Sure. First, I'd like to recognize 2 people tonight. One, our Director of Community Development, Paul Workman, for all of his efforts tracking and keeping council updated on the housing legislations and ongoings at the state. And second, I just want to commend our mayor for You know, I say this with terms of endearment. She was a bulldog at all these legislative issues. And we're very lucky to have her, and thank you for all your help.
That's very sweet. Clearly not that mean of a bulldog, because they all passed, but oh well. Which way do you want to start? Yeah, we'll just, city attorney.
I actually have not so much a report, but it's a report of my own activities. I did participate in the Parks and Trails scavenger hunt this Saturday, and it was great. My husband and I had a really fun time. The trails were beautiful and beautifully maintained. It was so many kids out in the park, less folks on the trail, but more probably than might have normally been on a Saturday morning. That was a little chilly, but luckily the weather was nice. It was just really a lovely event, and I hope we can continue to do things like that in the future. Yeah.
And I guess I should have mentioned in my report as well that it just seems like years ago, but I did attend the Earth Day celebration at Quincy Farm that was hosted by the Land Preserve, and it was also an amazing event. Over 200 people, lots of little kids enjoying that property. I think exactly as envisioned. It was a beautiful sight. Director Furman.
Thank you and good evening. Just an update on the purchasing policy that we kind of talked about a little bit at the council retreat, but we have made a significant amount of progress on a draft policy. And I just want to thank staff for taking the time to really get into the weeds there and make some significant improvements to that, hopefully. I don't know if it'll be presented to council before or after August, but we'll see it. Might be before August, so thank you.
Clerk Gillespie.
So yes, thanks to Councilor Eber and Mayor Pro Tem Wheel for conducting the interviews for our openings. We have heard back from most of the applicants. They're excited to start serving once they get appointed, and that those resolutions are on your agenda for the next meeting. And then with the events, both the Art Commission event and the Parks Commission event both went really well, especially considering not great weather, but we got really good crowds at both. So.
Thank you. Yeah, I was also at the Art Commission event, and I got to admit, the In-N-Out burger truck was a huge draw. So, all right, Director Workman.
No formal update for me, but I want to echo Jim's comments and congratulate the mayor on all the work that you did behind the scenes that nobody will ever know about. You really did work for your residents and for your constituents, and you should be recognized for that in a public setting like this. So well done.
Well, thank you very much, but thank you to you. You were on top of it and communicating with everyone. There was a lot to communicate, so it was a team effort. Director Goldie.
Our next event is our spring cleanup, Saturday the 18th. And we do accept if any of our residents can't make that for religious reasons, we always, we'll have Friday drop off, or during the week if it's electronics. We will not take your shredding. We don't want to be responsible for anybody's identity. So that'll be our next big event a week from Saturday.
Awesome. Thank you, Commander.
Good evening. Just a few things. Our Citizens Academy is still continuing strong. The class is about halfway completed now, and they're all really enjoying that. Saturday, April 27th, we held our semi-annual drug take-back. And this year, or this time when we did it, we took in 192 pounds of prescription and over-the-counter medications, which is more than double than typical. And from what I hear from everybody that's across the street that's been here a long time, that's the most they've ever seen come in. So really good testament to the residents coming out and disposing of this stuff properly. And lastly, to end it with everybody's favorite, K9 Tuco and Officer Ives, just want to give an update on him. He's passed all his certifications for drug recognition, and he's continuing to work on his patrol and obedience certificates, and hopefully he should be done in about 2.5 weeks here, and you'll see him out on the streets. And that's all I have.
Meet him. Mr. Sharm.
I have no report, but thank you.
Okay. Okay, well, If there's nothing else, then I guess
Move to adjourn.
no objections, and we are adjourned at 7:08 PM.